health authorities and international agencies are currently monitoring a significant resurgence of hantavirus pulmonary syndrome across the Western Hemisphere, a condition often described by the rapid and devastating onset of respiratory failure in otherwise healthy individuals. In the first half of 2026, the World Health Organization and the Pan American Health Organization have documented a sharp increase in viral activity, particularly concentrated in the southern cone region of South America. This surge has culminated in a high-profile international outbreak linked to the expedition cruise ship MV Hantavirus. As of May 2026, officials have confirmed a cluster of severe respiratory illnesses among passengers and crew, with a case fatality rate currently estimated at 38% among those who progressed to the severe pulmonary stage. This specific outbreak has been identified as the Andes virus strain, a pathogen of particular concern to virologists because, unlike many other hantaviruses, it has demonstrated the capacity for limited human-to-human transmission through close contact. The broader 2025-2026 reporting period has seen over 229 confirmed cases across 8 countries in the Americas, including Argentina, Brazil, Chile, and the United States. While the general public risk remains low, the clinical profile of the disease justifies the level of official alarm. Hantavirus pulmonary syndrome typically targets young, robust adults, turning a mild febrile illness into a life-threatening emergency within hours. The virus belongs to the Hantaviridae family and is primarily hosted by various species of rodents. It enters the human population when individuals inhale aerosolized particles of rodent excreta, urine, droppings, or saliva, often during activities like cleaning out cabins, barns, or logging in rural areas. Once inhaled, the virus begins a silent incubation period that can last from 1 to 8 weeks, making the initial source of infection difficult to trace. For the global health community, the current spike in cases underscores the volatile nature of zoonotic diseases and the critical importance of robust environmental surveillance and rapid diagnostic response in preventing localized clusters from evolving into broader public health rises. The current investigation into the MV Hantavirus cruise ship outbreak highlights the complex logistics of modern infectious disease management. In May 2026, the Centers for Disease Control and Prevention deployed a specialized team of epidemiologists to the Canary Islands to meet the vessel following its journey from Cape Verde. This response was triggered after the World Health Organization received notifications of multiple deaths and critically ill passengers aboard the Dutch-flagged ship. The primary hypothesis from health officials suggests that the index case likely contracted the virus through environmental exposure in Argentina prior to boarding, illustrating the long incubation period that allows the virus to travel across borders undetected. For American citizens involved, the United States government has initiated a medical repatriation plan, directing passengers to Offutt Air Force Base in Nebraska for transport to the National Quarantine Center. Inside the lab, the diagnostic process remains a race against time. Early symptoms, such as fever, muscle aches, and headache, are nearly indistinguishable from common influenza or COVID-19, often leading to dangerous delays in specialized care. It is only as the disease enters the cardiopulmonary phase that the unique mechanism of hantavirus becomes clear. Unlike many respiratory viruses that cause direct tissue destruction, hantaviruses infect the microvascular endothelial cells, the lining of the blood vessels. This infection causes the vessels to leak fluid directly into the lungs, effectively drowning the patient from the inside. Official statements from the CDC emphasize that because the virus can mimic more common illnesses for the first 72 hours, repeat diagnostic testing using polymerase chain reaction or sequencing is often required to confirm the presence of viral RNA. While the medical community has improved its ability to detect these pathogens, there remains no licensed vaccine or specific antiviral treatment for hantavirus pulmonary syndrome. Hospitals must rely on aggressive supportive care, including the use of extracorporeal membrane oxygenation, or ECMO, which bypasses the lungs to oxygenate the blood externally. Data suggests that if this intervention is started early, survival rates can improve significantly. Yet the sheer speed of the viral progression continues to challenge even the most advanced intensive care units. Prevention and long-term surveillance remain the primary tools for mitigating the threat of hantavirus, as researchers work toward a more definitive cure. Public health guidance issued in May 2026 focuses heavily on the 42-day monitoring window for individuals potentially exposed to the Andes virus strain. During this period, contacts are advised to conduct daily temperature checks and self-isolate at the first sign of fever or respiratory distress. Because the virus is frequently linked to environmental disturbance, officials are reminding the public that routine activities, such as cleaning a dusty shed or handling firewood, carry a specific risk in endemic areas. The recommended protocol for cleaning suspected rodent-infested areas avoids sweeping or vacuuming, which can kick up the dangerous aerosols. Instead, a solution of bleach and water should be used to thoroughly wet the area before wiping. In the clinical setting, the CDC has reinforced the need for airborne infection isolation rooms and N95 respirators for healthcare workers treating suspected Andes virus cases. Despite these precautions, significant unknowns remain regarding the precise environmental triggers that lead to seasonal surges in rodent-borne viruses. Surveillance teams continue to monitor rodent population dynamics and climate patterns that might contribute to increased human-rodent contact. While the 2026 outbreaks have tested international health coordination, authorities maintain a calm stance, noting that the virus does not spread easily in well-ventilated, general public settings. The focus remains on rapid identification at the clinical level to ensure patients reach specialized facilities before the onset of the critical pulmonary phase. As this situation evolves, the transparency of lab data and the speed of contact tracing will be the deciding factors in containing the current cluster. For more updates on global public health developments and surveillance reporting, consider subscribing to this channel. The clinical and laboratory response to hantavirus pulmonary syndrome is characterized by a high-stakes race between diagnostic confirmation and rapid physiological decline. Because the initial symptoms, fever, myalgia, and gastrointestinal distress, mirror common seasonal illnesses, the medical community faced significant hurdles in identifying cases before the onset of the critical cardiopulmonary phase. Public health agencies, including National Centers for Disease Control and regional health ministries, classify hantavirus as a nationally notifiable condition, requiring immediate reporting from clinicians. Once a suspected case is identified, the diagnostic pipeline moves into specialized laboratories capable of high-level biosafety containment. The gold standard for confirmation involves serological testing to detect IgM and IgG antibodies or the use of reverse transcription polymerase chain reaction, known as RT-PCR, to identify viral RNA in the blood or tissue samples. However, in the earliest stages of the disease, these markers may not yet be present in high enough concentrations, forcing medical teams to rely on specific hematological indicators. Clinicians often look for a triad of signs: thrombocytopenia, which is a low platelet count, the presence of atypical lymphocytes or immunoblasts, and a rising hematocrit level, which indicates that fluid is leaking out of the blood vessels and into the surrounding tissue. This leakage is the core mechanism of the disease's lethality. Virologists have established that the virus targets the endothelial cells that line the capillaries, particularly in the lungs. Unlike many other viral infections that cause direct cell death or massive inflammation, hantavirus appears to disrupt the integrity of the vascular system without destroying the cells themselves. This results in a sudden, massive shift of plasma into the alveolar spaces, essentially causing the lungs to fill with fluid. The headline assertion that doctors are powerless reflects the current lack of a targeted antiviral treatment or vaccine for hantavirus pulmonary syndrome. While the drug ribavirin has shown some efficacy in treating hemorrhagic fever with renal syndrome caused by Old World hantaviruses, clinical trials have not demonstrated a significant benefit for the pulmonary form prevalent in the Americas. Consequently, the burden of care shifts entirely to aggressive supportive measures. Hospitalization in a dedicated intensive care unit is mandatory once the respiratory phase begins. The transition from early symptoms to full-on respiratory failure can occur in as little as 4 to 24 hours. During this window, medical interventions focus on maintaining oxygenation and blood pressure. Standard mechanical ventilation is often insufficient because the lungs become too fluid-logged to exchange gases effectively. In high-resource settings, this has led to the deployment of extracorporeal membrane oxygenation, or ECMO. This advanced life support system temporarily replaces the function of the heart and lungs, circulating the patient's blood through an artificial lung to remove carbon dioxide and add oxygen. Data from previous outbreaks indicate that while the case fatality rate remains near 40%, survival rates are significantly higher for patients who are transferred to ECMO-capable facilities before they reach a state of irreversible shock beyond the hospital walls. The core developments in hantavirus management involve extensive environmental surveillance. Public health departments monitor the density and infection rates of reservoir hosts, such as the deer mouse in North America or the long-tailed pygmy rice rat in South America. This ecological data allows agencies to issue localized alerts when environmental conditions, such as mild winters or increased rainfall, lead to a mass-year Korea surge in food supply that causes rodent populations to explode. By tracking these patterns, officials can predict periods of increased risk for human-rodent contact. Despite these monitoring efforts, the logistics of prevention are complicated by the fact that many infections occur during routine activities in rural or semi-rural settings, where the presence of the virus is not always apparent. The contrast between the sensationalized, powerless narrative and the reality of modern medical surveillance is found in these systematic, data-driven efforts to intervene before the virus can reach a human host. The most effective defense against hantavirus pulmonary syndrome remains a rigorous, science-based approach to prevention and environmental management, as medical science has yet to produce a preventative vaccine or a direct cure. Public health authorities emphasize that, because the virus is contracted through the inhalation of aerosolized rodent waste, the primary goal of any prevention strategy must be the suppression of rodent populations in human living spaces and the safe decontamination of potentially infested areas. Practical takeaways for homeowners and workers in rural or semi-rural areas focus on the seal, trap, and clean protocol recommended by the Centers for Disease Control and Prevention. This begins with structural mitigation, sealing any entry points in homes or outbuildings that are larger than 1/4 of an inch, roughly the diameter of a pencil, using materials that rodents cannot chew through, such as heavy-duty hardware cloth or steel wool cemented into place. Furthermore, maintaining a clean perimeter by removing wood piles, tall grass, and trash from the immediate vicinity of a home reduces the likelihood of rodents establishing nests near human activity. For those entering seasonal cabins, barns, or storage units that have been closed for extended periods, the risk of encountering concentrated viral loads is at its highest. In these settings, the critical rule is to avoid any activity that might stir up dust. Sweeping or vacuuming a space contaminated with rodent droppings can launch viral particles into the air, where they remain suspended and easily inhaled. Instead, officials advise a wet cleaning method, opening doors and windows for at least 30 minutes of ventilation before entering, and then thoroughly saturating any droppings or nesting materials with a disinfectant solution, such as 1 part bleach to 9 parts water, after letting the solution soak for 5 minutes to ensure the virus is deactivated. The materials should be wiped up with a paper towel and double-bagged for disposal. Global surveillance efforts are increasingly focused on the ecological drivers that precipitate hantavirus outbreaks, acknowledging that human health is inextricably linked to environmental stability. Organizations like the World Health Organization and the Pan American Health Organization utilize a One Health framework, which integrates data from veterinary, environmental, and medical sciences to monitor the reservoir hosts of the virus. This includes tracking climate patterns, such as the El Niño Southern Oscillation, which can lead to increased rainfall and a subsequent mast of seeds and fruit, providing an abundance of food for rodent populations. By monitoring these environmental triggers, health departments can issue early warnings to high-risk communities before human cases begin to emerge. However, significant limits of knowledge remain a challenge for the scientific community. While the transmission cycle from rodent to human is well documented, researchers still struggle to explain why only a small percentage of people exposed to the virus develop the lethal pulmonary form, or why certain years see a dramatic spike in viral virulence. The development of a hantavirus vaccine also remains in the experimental stages. Because the disease is relatively rare and outbreaks are sporadic, conducting the large-scale clinical trials required for regulatory approval is logistically difficult and ethically complex. The ethical responsibility of public health reporting in this context is to provide clear, actionable information without inciting unnecessary panic. While the high fatality rate of hantavirus is a matter of factual record, the risk to the general urban population remains statistically very low. Health officials urge the public to maintain a balanced perspective. While vigilance is necessary in endemic areas, the virus does not typically survive for long periods in sunlight or well-ventilated environments. The current surge in cases serves as a reminder of the persistent threat posed by zoonotic diseases and the necessity of maintaining robust public health infrastructure. As we look toward future developments, the focus will remain on improving rapid diagnostic kits that can be used in rural clinics and continuing the search for broad-spectrum antivirals that could mitigate the damage during the critical respiratory phase. Until such breakthroughs occur, the safety of individuals in high-risk zones depends on informed behavior, environmental awareness, and a swift transition to intensive care at the first sign of illness. By understanding the mechanics of transmission and the importance of early intervention, communities can better protect themselves against this swift and severe pathogen. For continued updates on global health surveillance and emerging viral threats, consider subscribing to this channel.